Now it is my honor to introduce today's guest, Chief Brian Peete. Chief Peete is the Chief of Police for Montpelier, the capital city for the state of Vermont, where he leads a dedicated police department of 27 full-time members of officers, administrators, parking enforcement, and regional emergency communications dispatch personnel for a daytime population of over 20,000. Prior to Montpelier, he was the chief for the Alamogordo Police Department in New Mexico, a municipal agency of 88 sworn and non-sworn staff for a population of 32,000 residents. Chief Peete served in the city of Chicago's Inspector General's office as the Chief Forensic Audit Investigator for Public Safety and as one of the Inspector General's chief investigators. He also served within the Chicago Police Department for nearly 10 years as a patrolman, field training officer, and fusion center analyst. He also served in the federal law enforcement as a special agent for the Air Force Office of Special Investigations in the positions of Assistant Special Agent in Charge, Detachment 206, Las Vegas, Nevada, where he deployed to Afghanistan in support of Operation Enduring Freedom and coordinated U.S. and Afghan forces in over 150 counter-espionage, counterterrorism, counterintelligence, and force protection missions. Chief Peete is a graduate of Northwestern University's School of Police Staff and Command and has an MA in police psychology and a BS in sociology. He holds the position of first president for the Vermont Association of Chiefs of Police, serves on the CIT International Board of Directors, and is also a member of the International Association of Chiefs of Police and the National Organization of Black Law Enforcement Executives. Thank you for being here today, Chief Peete.
Thank you. It's an honor and a privilege to be here.
Absolutely. That is an impressive bio, and I'm happy to share it at full length.
Thank you so much. It makes my head spin thinking about that. Make me sound out better than what I am.
Right. We're here today to talk a little bit more in depth about our program that we had a few weeks ago, which was the Network for Lasting Change. And the way that you and I met was actually to discuss our new network, Caleb. And I wanted to just get your initial reactions on Caleb and, hear what you're looking forward to as this network grows.
My initial reaction was as soon as I heard about it is so communication has been the bane of every organization I've ever been a part of. And it's always something, a talking point and something that we're all told that we need to make sure that we get it right so that we can get our responsibilities done correctly. And when I heard about Caleb, I just thought this was a phenomenal opportunity to do that communication, to bridge those gaps and to share information. I see the value in it, and it's going to be, I think, in just an extraordinary tool, and how we move forward when we look at where policing needs to go and is going to go.
What's the potential, you think, if you had to, think about 3 years into the future? This network now has, 10,000 users around the country who are, sharing information, sharing best practices. What type of impact do you think that could have?
It's phenomenal. I think this is going to be the platform. It's going to be where folks who are, you can look at things like mentorship. You can look at things like community development, the sharing of ideas. And it's real time, which is the good part about it, that, as young chiefs like myself, or, can reach out, ask questions, and then develop those connections and those relationships, because I honestly think that we're social beings and we're social people. And when you get the opportunity to know somebody and to feel their personality and to work with them, that trust grows. And through building that trust, and those connections grow and the communications flow. And then we look at how we, more standardized responses into the way we do things, not just like within our own municipalities and little boxes, that it becomes the norm. It becomes the standard. It becomes a benchmark. And I think that we have a brilliant opportunity to find out what's all working and apply it ourselves.
Talk to us a little bit just about crisis intervention training and, some of the resources that other departments and communities would really benefit from?
Well, crisis intervention training, or crisis intervention teams, or a crisis intervention team program, or CIT, is it's an entire program. So training for law enforcement is an initial layer. CIT was basically developed, or it was developed in Memphis, as law enforcement and the communities that it served, or in Memphis, realized that there's more to what we need to understand, and how we deal with folks who are going through mental health crisis. And so through that, there came the understanding that law enforcement needs to know and needs to be able to recognize what it's seeing, or as officers, we need to be able to recognize what we're seeing as it's right in front of us. Once we recognize that, it helps us in our response and how we deal with it, and that we deal with it in a manner that's going to be safe for ourselves, and it's going to be safe for those who we're dealing with, who we're working to try to help. Because ultimately, that's what we're here to do. We're here to serve. We're here to protect. And so with that training component, somebody may be in crisis, and law enforcement is called to respond to help. Once we can de-escalate that situation, okay, that's great, but that's a one-time incident. So the CIT concept is, how do you build around that? How do you minimize the opportunity, or how do you minimize the instances of where somebody has a mental health crisis, and who is more appropriate to respond to it? So once we've can kind of de-escalate the situation, so where do we go from there? You reach out to organizations and other resources that can provide help to those in crisis, who can provide help to their families, to helping them to build a support network, so that we can just reduce the instances that these things occur, and we form partnerships ultimately to get people the care that they need in an environment that's right for them, in the comfort of their own home, with an outpatient model rather than an inpatient, or involuntarily committing people to hospitals or to institutions. It's extraordinarily valuable, because it also puts out this roadmap to building community resources, not into just response to mental health crisis, but to the other things that we're all dealing with, and that we all have limited resources in addressing. So it's just the coalition of teamwork and the framework and how this is done. It's true, when done correctly, it's true collaboration, and it's getting people who have the ability to affect change, an immediate change in the same room, to pooling all organizational or all societal resources that we have, or all the community resources together, to where we can do most good before it becomes an emergency, or before it becomes something that needs to be dealt with through the criminal justice system.
And so historically, how is this different from how police officers were trained, a generation or two ago? What's the evolution that's occurred that is significant, that maybe perhaps members of the community don't know about?
So from a personal standpoint, I've had the privilege to be able to see, through sociology and through psychological work, of what's out there, and kind of having the understanding of knowing what it is that I'm looking at when something presents itself, when I'm responding to a call for service. And then I imagine, when I was younger, when I was on the federal side of the house, and I would come out to a call, or move to help something, or respond to something, I wouldn't quite know what I was seeing, and it really affected the way in which how I treated that situation. So if I come into someone and they have a personality disorder, or if I come to somebody and there's a traumatic brain injury, for example, my response level, my reaction is entirely different than if I realize that this is not a threat. This is a person who is, going through a crisis, and I don't need to go hands-on. I can de-escalate this situation by using time, and by trying to appeal to this person to gain trust. So law enforcement, from call to call, the push is deal with the situation, handle the situation safely as best as possible, free yourself so you can move on to the next call for service. And in that rush to do that job, we're just not doing what we need to do, sometimes to safely de-escalate situations and to have an outcome. In the past, it would be we're responding to the same person over and over and over again if there's a mental health crisis, and then there's also a dehumanization factor to it. That, oh, I know this person is XYZ, or this person, forgive the language, is crazy. And but if we don't use the resources that we have as a community, then those calls for service are going to keep coming, and law enforcement is going to be the one to primarily deal with it. So in the past, it's been something, I think, that's been a response for us and something that we've taken. But also historically, I think that when law enforcement began to understand the calls for service and dealing with folks who are in mental health crisis, the more we've realized that we're not capable in certain ways, that we're not trained to deal with it, and then in certain ways that we don't have the resources to stop these things from always occurring or to deal with them effectively, so that we're not repeatedly working with the same folks. And then there was a push that law enforcement was saying, we need to get out of the mental health business, and we need to be here for safety and security and to respond to crisis situations. But at the same time, there are many layers that can stop these things from getting to a crisis level if we all work together and find out when these triggers are about to occur and how do we prevent them or slow them down from happening in the first place. And what we found in a lot of places, that when we look at the time, when agencies have the ability to study their statistics and look at the time that they spend on certain types of calls, especially with calls for mental health services, you can see the numbers going down into how many times we interact with folks who are in mental health crisis, and just pretty much the sheer volume that law enforcement is spending more on proactive criminal related instances rather than responding to mental health care, where we are, quite frankly, not always the best agency to deal with some of the calls for service related to mental health.
So let's talk a little bit about, building that coalition, because, I think sometimes communities, whether they, don't have the right resources or the right individuals in the right seats with the right knowledge or understanding, may find it challenging to connect with, their police departments and, start to build this sense of coalition around some of these issues. So talk to us a little bit about some concrete steps that you've had experience, whether that's in, Chicago or Alamogordo or Montpelier. What's really worked in your experience, and what can people take away from this conversation to get started, in their community?
I think that ultimately it has to be, just bluntly put, egos have to go away. And there has to be a realization of that we're all here for the common good. And in some cases, you may have, and again, I'm sorry to butt right back to Caleb, but just that opportunity and the way to through those conversations and through that communication, those relationships are formed, that trust forms, and folks are more apt to saying, we can work together, and you can kind of see that power and see that trust to other folks to do what's right. And in different spaces that there may be a better fit for somebody else to take the leadership of. But often in cases, there may be a problem that several organizations are grasping with, because things like mental health touch so many social service agencies and so many government agencies, that this group may have a different idea in what direction to go. This group may have a different idea to go. In other places, it may be everyone else is on board, but law enforcement may not be on board. Law enforcement may want to continue doing this, and where another community wants to do this. So how do we forge that trust that it's not an us versus them, it's not a me versus you, it's not a you're making me look bad kind of thing. Again, it's just how do you put those egos aside and do what we all need to do to bring safety to the community, because ultimately the community doesn't care who's right. The community cares that we get it right. No one calls law enforcement with the hope or the expectation that the loved one that they need help dealing with is going to be hurt because of a law enforcement response. Law enforcement doesn't want to hurt anyone that we're responding to help. So I think that in a time that we're increasingly becoming more polarized with each other, that we especially have to remember what holds us together and build on that. And that's, again, and I'm sorry if I sound like a plug for the platform, but that's what really excites me about this opportunity, that we all realize we're all in the same boat, we're all working towards the same common good, and having that reminder helps us to bridge those interpersonal relationships.
Perfect. Thank you for plugging Caleb over and over again. I certainly don't mind at all. And so with that, we'll close it out. I want to thank you for taking the time to share some of your experiences and some important takeaways for our audience. The bottom line is, the more that we know about the experience and sacrifice of officers around the nation and throughout history, the more we, the museum, can contribute to a better understanding of our society and the role law enforcement has within it. I also want to thank everyone who watched today's program and considered making a contribution to the museum's programs in general. We hope our conversation today gave you a sense of what's possible through the Caleb Network. We created Caleb to do exactly what you experienced today, to bring together leaders in law enforcement and the community, and to provide a platform for ideas and best practices, to share resources and create new programs that engage each other in really important dialogue. This new digital community is available now. It's available on Apple and Google Play stores. It's no cost, and it is available for all mobile devices except flip phones. If you still have a flip phone, it's time to upgrade to a new phone that you can put Caleb on. So please join us there on Caleb and be a part of this important discussion. Many thanks again to our supporters and collaborators, DuPont and Thomson Reuters, for championing this and making this all possible. Farewell, and thank you to all the law enforcement officers out there. Be safe.